a tooth and is left unchecked, the decay-causing bacteria can destroy the tooth beyond saving it, ultimately leading to tooth loss. The socket, when healing, will result in a loss of bone at the site and around the nearby teeth. The result of the missing tooth and resulting bone loss in the area is a shifting of adjacent and opposing teeth into the space left by the tooth loss. The result of these teeth shifting is that it becomes much more challenging to keep the teeth clean, resulting in areas of accumulation of plaque and tartar, resulting in inflammation and increased risk of decay. The shifting position of the teeth may also result in a change in the bite, which over time may lead to poor function and grinding. Changing of the position of the teeth due to the imbalanced forces. Fracture of the enamel of the teeth along the gum line, also known as abfractions. Excessive wear of the teeth. And overall imbalance in the muscles of chewing and signs of popping, clicking, or pain from the temporal mandibular joint, also known as TMJ.